I'm Dr. Luz Fonacier, the president of the American College of Allergy, Asthma, and Immunology. Many people don't know that eczema and allergies are related, and that eczema is often triggered by allergies and treated by allergists. In our previous video, we talked about eczema, a common skin condition that involves many uncomfortable symptoms. Eczema can be extremely challenging for people of color as it reveals itself differently and the symptoms can be more severe. In this video, we talk about how telemedicine can be used in the diagnosis and treatment of eczema, especially in skin of color. Over the course of the pandemic, many people turned to telemedicine and found it an efficient way to communicate with their physician. I am joined today by my colleague, Dr. Tania Elliott, who is also an allergist and an expert in the field of telemedicine.
Thanks, Dr. Fonacier. I'm Tania Elliott, an allergist, spokesperson for the American College of Allergy, Asthma, and Immunology, and Chief Medical Officer of Virtual Care for Ascension. Telemedicine is a great tool for patients who have allergic skin conditions like atopic dermatitis or eczema. And that's for a few reasons. One is it allows you the opportunity to identify a doctor that's right for you, that's well-versed in experience in treating the type of problem that you're having, and you're not limited by your geography or where you live. Another thing it's great for is if you have a relationship with your allergist, maybe you want to schedule a video visit to show them that something might be flaring up or getting worse, or maybe if you're not so sure of what the diagnosis is. Another benefit is that you can take a photo of your skin condition and actually track over time how your condition is doing. So by using your smartphone, and now most smartphones these days have a forward-facing camera, and a lot of times the zoom is really good. You can zoom in on the skin condition, which is even better than going into the doctor's office and having the doctor look with the naked eye. Because especially with people who have different skin colors, the diagnosis is key and things don't always present the same way. The last thing I'll add is with a video visit with your doctor, there's an opportunity to include multiple people on the visit with you. So this is great for if you have an older family member who has a skin issue or maybe a child and you want to have multiple caregivers on the call. Oftentimes the video visit can accommodate up to 4 participants at the same time. So that really assures that you're going to get all the people at the table who have an history of what's going on with you to make sure that they get that right diagnosis.
So here's what you should expect from a telemedicine visit for eczema. You will give the history of your journey with atopic dermatitis. You will be asked questions. What age did it start? What areas did it involve? What therapies have you tried? And whether you have any other allergic problems such as asthma or food allergies. A physical exam will be done just like you would have in the office. You can also send pictures beforehand. You will want to identify a physician who is accustomed to caring for patients with your skin color, and they will lead you through describing the state of your skin dryness, roughness, lumps, bumps, oozing, scaling, and the location in which you have them, and how itchy you are. A conversation about what treatments might best fit you for managing your atopic dermatitis is important. This is called shared decision making. This means that you will be asked, what do you want to do next? What therapy did you choose? Which one will benefit you the most? You will ask about all the different therapies and what might work best for you. Get your questions answered and make an informed decision and commitment to a treatment plan.
So there are some things we would want to take into consideration when we're preparing for a video visit with our doctors. Making sure that you know how to use the camera. You can flip it around because sometimes the doctor will ask you to flip the camera around so it's pointing towards you and then guide you through how to hold the camera to do the skin evaluation and examination. Making sure that the lighting is right. And ideally, if you're going to have multiple visits, you can do them in the same location with the same type of lighting so that it is one less variable and the doctor can get the most accurate evaluation and view of your skin. And also take into consideration that you might need to participate in the visit. And we call this a patient-guided examination, where sometimes the patient, you need to be the hands for the doctor. So it's not very different from what happens in the office. The doctor evaluates and generally looks at your skin, but then sometimes they'll touch the skin. And so for a video visit, you need to be your doctor's hands for them. And that might mean pressing on a skin lesion and seeing whether or not the lesion or area stays red, or asking you whether it looks or feels lumpy or bumpy. And then maybe even during the visit, having you snap a quick photo and zooming in on that skin lesion so that we can make sure to get an accurate diagnosis. Now, remember that the treatment plan will be a comprehensive treatment plan that your doctor comes up with you, and telemedicine can be used both in addition to in-person visits to have what we call a longitudinal relationship over time. So it's not a one and done, just see your doctor through telemedicine and then never again. Sometimes you see the doctor in person, and then other times you can see them through telemedicine, and other times you might just be communicating with them through a patient portal with photos. At the end of the day, though, the treatment opportunities for you are the same, and you'll get a comprehensive treatment plan whether you have a telemedicine visit or an in-person visit. And that can include anything from over-the-counter moisturizing regimens to prescription creams, all the way to coordinating care for, let's say, an injection, or we call a biologic therapy that might need to be done in the office. But all of those medications and things can be coordinated for you or sent to your pharmacy through a telemedicine visit, just like you could have in person.
The American College of Allergy, Asthma, and Immunology and the Allergy and Asthma Network are pleased to bring you this information in the hopes that it will help you diagnose and treat atopic dermatitis, especially in skin of color. Thank you.